experience has been extremely positive. The biggest thing is it helps more patients. The other thing is that the treatment and the workflow, the protocol is easy to accomplish. And if you have a real set protocol, then it's something that can be very predictable and very satisfying for patients. And in my office, we do a lot of edentulous cases. It's kind of like, edentulous solutions, for the implant patient in my practice. And so I've done a lot of these cases, and including some immediate load cases. And we'll talk a little bit more about where I think you should start and how you should do that. So, everybody asks, okay, hey, I got my locator fix kit now and I'm ready to do cases, and where are those patients going to come from? And I think, you know, the real value is that these patients are, for the most part, already in your practice. And so it's really a good solution because you can reach out to these patients that, need that care. They already trust you. And so now when you show them this new technology and the ability to take them from the locator that they had that came in and out to a fixed solution is just a really good, offering to the patient. And it'll make a big difference in what we can do. And then the interesting thing is new patients come from those patients going to tell somebody else of how it went for them. So now there's also nothing wrong with marketing to new patients and getting them in to do this technology as well. But for the most part, I think the patients are already in your practice. And who are those patients? They are your patients that have dentures already. They're your patients that are soon to be edentulous. In other words, they have periodontal disease or they have broken down teeth, and they're going to need to have an edentulous solution. And most patients want a fixed solution, and Locator Fix allows that to be in a whole lot more economical solution for the patient to have a fixed restoration. Well, in using your existing patient base or your software that you can communicate with your patients, what we do is we go in and send a letter out to all of our denture patients and say, hey, we have some new technology that could greatly benefit you. Please come in for an evaluation. And that kind of gets the ball rolling. You can also do that for the soon to be edentulous patients as well. Also, patients with partials. There's a lot of different people you can reach out to that could benefit greatly from that treatment. And so I think getting those patients in is a real benefit to that. And on that same line, I think the other thing that's really done it for our practice is that when we have our morning huddle in the morning, we're looking at all the patients, we're going over the patients and what we're going to do. We literally choose one patient that could benefit from this, and then we focus on presenting that to that patient. And it's part of, the hygienist educating. It's part of the assistants talking to them, and it's part of all of us just working together to really educate that patient on what it's going to do for them. It's going to give them their smile back. It's going to give them the ability to eat what they want instead of eat what they can. And so we spend a lot of time on, patients, they don't want implants. They don't want, that they want what happens from it. Those artificial roots that you put in, the restorations you put on, allow them to get back in the game. I've heard that a lot from patients. I need to get back in the game, and then also just to enjoy life and be able to to smile with confidence and not have to worry about some of the things we're going through now. I think a question I get a lot is how do you educate your team so that they can be very proficient in educating your patients. And I think, there's a lot of factors that go into that. And so one of the things that I do is, we'll talk about later, is documentation and getting great records and documenting your cases. It makes you better as a clinician, and it also allows you to use those cases to help educate your team. And I think, we do, monthly meetings, and we always highlight a case. And it's usually a case that it really made a difference in somebody's life, what it did for them. But we use that to educate and how that is. The other thing is any of these new technologies, we realize that, patients are getting the best dentistry has to offer, and they're making an investment in that. And so we want to make sure that up front they know that it's going to require maintenance, and we want them to be a part of that. So part of that is to training the hygienist on how to maintain these cases. And another huge benefit with Locator Fixed is, I've been practicing for 40 years and I've been doing all annexes for a long, long time. So we have to treat and maintain a lot of these patients. And, traditionally when they come in, I have to put them in my chair and drill out the composite, take out the Teflon, undo the screws. Then the hygienist has to come in and do their thing. Then I have to put new screws back in and fill it back in. Today with Locator Fixed, I literally walk in the hygienist operatory. I use the removal tool and take it off. Takes a few seconds. Then my assistant puts new attachments and does that, cleans it up. My hygienist cleans. I walk back in the room. I use the insertion tool, snap it back in. So maintenance is just a whole lot better solution, in this scenario. For morning huddle, we actually, look for patients that we know could benefit from the treatment that we can give, and specifically for implants. And it's really easy to go through, and you're looking through and saying, oh well, they've had a denture, they haven't had, they had a lot of sore spots, they haven't been happy with it. So this is a patient that could greatly benefit from that. We also look at patients that already have overdentures, and they've had them for a while. They're starting to have issues with them, and we know that if we could present them an affordable fixed solution, that could benefit them greatly. So that's kind of how we kind of hone in on that particular treatment. So I get asked a lot too, like what records do we get? I mean, how do we take our patients? And I tell you the truth, you have to have a workflow in your practice for that. You have to be consistent, you have to be routine, and you want to get the information you need to be able to present a case. And more importantly, to diagnose the case. And it's all about seeing the end before you start. Because if I know everything about the case, I've done my homework, when I present it, I'm going to be very confident in the case that I'm presenting. And so it's very important, and we spend a lot of time training our team to gather the information. So in my office, we're going to do a CBCT scan. And so that's, one of the things we do. And even in my practice, my team would say, you know what, when you say scan, what does that mean? Is that an intraoral scan or is that a CBCT? So now in my practice, a scan is a CBCT. We get that. Then we get digital impressions. That's what we call an intraoral scan. So that way there's no confusion, and we go in and, and patients love it when you tell them, hey, we're going to take some molds of your teeth, but we're not going to have to put goop in your mouth now. We're going to be able to use the computer. You're going to be able to see it come up on the screen, and that creates value in itself. So we're going to get those records and check that. And then one of the most important factors that you do is photography. So digital photography, and not just haphazardly done. We have a set template of the pictures that I want that are going to make sure it gives me smile line, gives me midline, gives me complete smile, profile, everything I'm going to need to put the case together so that we can merge all that information together and come up with a restoratively driven treatment plan. That's kind of what we do. And so it's real important that those records are consistent and making that happen. I think financing is very important. I think, to offer patients a way to finance the treatment is a great thing. And there's many of them out there. We use Care Credit. There's others that are out there, but you need to have some type of financing agreement because that's what patients need to help them. The other way you can do it is you can break it down into phases. You can do, the surgery phase, and then you can do the restorative phase, and you can spend some time in between those to do that as well. Obviously in our practice, I'd love for them to pay it all up front, and my team's pretty good. We do get a lot of patients that do that, but not everybody's in that situation. So you have to be able to offer patients financing to be able to do that. And the great thing about Locator Fixed is that, there used to be like, okay, a fee for a denture, a fee for 2 implants and an overdenture, a fee for 4 implant and center over denture, and then there was a huge gap to where you went to all NX. And so, there was a gap there where a lot of patients couldn't afford that area. Well, Locator Fix now gives another alternative to patients, and so they can get a fixed solution at a more reasonable fee. Another thing that I think is real important as you do these cases is that you come up with a case fee for the different scenarios. And so you'll have a case fee for 2 implants in an overdenture, and a case fee for 4, and then a case fee for Locator Fixed. And so the reason I like case fees is that, you know, it's easy for your team to present and understand it. It's easy for the patient to understand it. And, you can figure out what that is based on the number of implants you're putting or what you're going to do, all the different factors. And so that's a sliding scale. It's not the same, 100%, but it's just a whole lot easier to deal with that. The investment to take care of this solution is going to be this, and focus on not how you're doing it, but on what it's going to do for the patient. We're going to get rid of infection. You're going to feel so much better when we do that. We're going to be able to use these artificial roots so that you're going to be able to smile with confidence and eat what you want to eat instead of what you can. And what I mean by that is go to a restaurant, open up the menu. I want to eat this today versus what's going to not embarrass me today. So, those are the things that I see how much patients are just happy about. It's more of an emotional decision than anything else. When we talk about, presenting cases, and case acceptance in general, you know, I don't do it the same for every patient. And here's why. If I have a type A driver personality type and you start showing them all the CBCT and all this stuff, they're like, you know, get to the point. And so those patients, I tend to talk to them about, this is the benefit you're going to get, and it's going to take this amount of time. And I know you probably prefer the first appointment in the morning, and we're going to get that scheduled and get that done. And one of the reasons is if they're that type, if they're waiting in my waiting room, my blood pressure goes up. I don't need that. So I want them to be the first patient and do that. Now, on the other hand, if you have an analytical patient, they're going to want to see everything. And so, yeah, I'm going to show them all the bells and whistles. I'm going to show them my virtual treatment plan. I'm going to show, the wax up and the end results. And I think that's a key factor in treatment planning. I also think too, it's real important that you spend time on the teeth, on the wax up, what it's going to look like before you spend time on where the implants are going to go. Because if you can get that situation taken care of first, then everything is going to fall into place. And so that will really help in the treatment planning and the part of it. So I think I kind of just feel for my patients and what they do. However, most patients like to see a model. They like to feel and touch what it is, see it. That's a real big thing, and Zest has some great models to use for that. So, that's a good solution. I think photographs are a big thing. That gets back to documenting, not only getting records, but I document the cases as I do them. And so then I have several cases that we show before and afters that I have permission from those patients. And some of those patients, I have permission to tell these patients to call them if they would like. And so, sometimes they'll do that. And I always say, what do they say? And they say the only thing they wish is that it done it sooner. So, it helps to be able to document these cases and have cases that you can show that are similar to them. Obviously you don't have to show faces if you don't want to. Most of my patients give permission so I can do that. And I think that's a big help to be able to show people what they're looking at. In my, all the paperwork that we do, there is one part on there that we have them signed to take photographs of cases, and mainly it's for an educational situation. However, if I'm going to show their face in a different realm, if it's not just me looking at it to diagnose, then I get permission to do that, because I think that's only right. You want to make sure you have permission from your patient to do that. And most of them are happy to do it because they're so excited about how they are. And so it's a good thing. and I do it as, okay, I'm going to use this for education. Are you okay with me, doing that? Or do you mind if I show other patients, how they can benefit from the treatment that you have? And and I respect them. If they say, "Oh, and I don't want to do that," then that's okay. I understand. But most of them are okay with it. So when I got started with Locator Fixed and looking at the technology and doing it, I think the ideal patient is a patient that's already in your practice that has an overdenture already. So the implants are already integrated. You have to have a minimum of four. Um, they're already integrated already, and now you can do a very smooth, easy transition to upgrade them to a locator fixed solution. And so, for example, this is how easy it can be. If you have a great fitting overdenture, if the patient comes in, now all you have to do is you put the scan bodies on the abutments, you scan it, then you take and scan the intaglio and the whole surface of the prosthesis. And then you put it back in the mouth, you scan the opposing and a bite. And from that, sending it to the laboratory, the next thing you're going to get back is a PMMA try-in that is designed for a fixed restoration. And so you'll try that in, check aesthetics, phonetics, function, bite, everything about it. If everything looks good, then you can go to a final restoration. So it's very little chair time, but the results for the patient are huge because they go from a removable where they've taken it out and clean it to where it stays in your mouth all the time. And if patients have to choose, most of the time they're going to choose the one that stays in. And so I think that's where I would start because those are just literally the easiest transition that you can do. And I use a digital workflow, but you don't have to. You can use an analog workflow, digital workflow, doesn't matter, but you're going to be able to do something really great for that patient and with very little chair time. And that's the beauty of Locator Fixed. You're not changing the abutment. You're using the same abutment that they have and you're converting them to a fixed solution with the same abutment. And so that's why it makes it so easy to do this. Now when I treatment plan, sometimes patients aren't ready to go to the high end solutions, but they're really ready to go. I'm so tired of this denture. Can I go to an overdenture where now the implants are supporting it? And so that's implant retained soft tissue supported. But those patients are going to be so happy because of what they do. But in my treatment planning now, what I do is I try to do surgery once. So I try to give them a foundation of the implants so that they can go with an overdenture. But if they ever choose to go to a fixed solution, you've already done the surgery. You can really upgrade them easy. What I've seen too many times is that, we started out with just putting two implants in, and then they come back 17 years later and they're saying, "Hey doc, it just doesn't fit like it used to." Well, what happened is, the bone's kind of gone, and so everything shifted. And so now they say, "Well, I'd really like to put more implants in." And a lot of times now it takes more grafting and other things. Whereas if you put the implants in, then you'll have that foundation and you'll be able to upgrade. And I tell patients that, let's do surgery once, and that way, if you want to upgrade, we can do that. And so it allows them to stage the treatment. And I think that's important with this as well. And being able to use the same abutment, that's the key to the success of this. I think when we talk about tips and tricks of things to do, it's just that, you know, if you start this patient out and you've kind of diagnosed it from the beginning and they continue to upgrade through the process, it just makes the whole transition easier from that. And now, even because you're using the same abutment, I will literally go in and do the pickup for locator fixed. And one little trick is, I always, before I put the final attachments in, I put the black processing ones back in, retry it in so I can take it in and out easily, make sure everything feels great, and then go and put the attachments in and use the insertion tool to put them in, because that just assures that everything is ideal before you put it in. So that's one thing that's helped, as I've done a lot of these cases and seeing that part of it.